Hi, how are you today?
Good, how are you?
I'm good. My name's Savana. I'm a first-year nursing student at the Lethbridge College, and today I'm going to be doing a head-to-toe assessment on you, if that's all right.
Yeah, that's fine.
So I'm going to be starting from your head, working my way down to your toes. I am going to be using my stethoscope to listen. I'm going to be doing some touching, some looking. I'm going to be doing some percussion where I'm just going to tap and listen for the sound. Do you have any questions before we get started?
Nope.
All right, can you state your full name and birthday, please?
Ashley Petrosolski, October 16th, 2001.
Perfect. And you know the date today?
March 20th, 2020.
Perfect. And you know where we are?
Seattle Grace Hospital.
Perfect. Client is alert and oriented ×3. So I'm going to be starting on your head. All right, hair is evenly distributed. Scalp is pink. Face is symmetrical. Skin is intact. No redness, no lesions. I'm going to feel your sinuses if that's okay.
Yep.
Any pain or tenderness?
No.
Frontal and maxillary sinuses have no tenderness with palpation. Temporal pulse is felt bilaterally. I'm going to ask you to move your jaw up and down. Perfect. Any pain with that?
No.
All right, temporomandibular joint moves freely with no crepitus. I'm just going to be feeling around your neck. No palpable lymph nodes. And now I'm going to take a look at your eyes, if that's okay. Sclera is white, conjunctiva is pink, and I'm going to shine a light if that's okay.
Yep.
Pupils are round and reactive to light. And now I ask that you follow this. And they accommodate. The nose is midline and symmetrical. Nostrils are patent bilaterally. Septum is intact, no crusting, no discharge, nothing like that. I'm going to be moving on to your ears if that's okay. Any pain with that?
No.
How about this one?
No.
Perfect. Now I'm just going to take a look. Other ear. Perfect. Moist yellow cerumen is present in both ear canals. And now I am going to take a look in your mouth. Perfect. Pharynx is pink and intact. Gums, lips, and mucosa are pink with no lesions. I'm going to ask you to move your tongue around. Perfect. Tongue is pink and rough with no lesions. Natural teeth are white and intact. Now I'm going to be moving on to your neck. Okay. I'm going to ask you to swallow. Perfect. Trachea is midline and swallowing reflex is intact. Carotid pulse is felt bilaterally. I'm going to ask that you move your head to the right. No jugular venous distension. And now I'm going to ask that you just move your head around in any way you can. All right, perfect. Looks like there's full range of motion in the neck. And now I'm going to be moving on to the chest. I'm going to ask that you just lower the gown if that's okay with you.
That's fine.
Perfect. I'm just going to sanitize my stethoscope while you do that and ask you a couple questions.
Okay.
Do you have any trouble breathing?
No.
Have you had a cough recently?
Nope.
All right. No pain with breathing?
Nope.
No. Nothing coming up? No.
Nope.
No mucus? No
Nope.
sputum? All
Nope.
right. Perfect.
All normal.
Looks like chest expansion and contraction is equal. Breathing is non-labored. Skin is intact, no lesions. There are some moles, but none of any size to be concerned about. They're all normal. So now I'm just going to take a listen if that's okay.
Yep.
Now while I'm listening, I just ask that you be quiet
Okay.
so I can get a good listen.
Yep.
And then take deep breaths. And it's okay if I move your sports bra?
Yep.
Okay, perfect. Now I'm just going to ask you to lean forward so I can give a listen on the back. Skin on the back is intact. There are no lesions, no redness, no bruising. The spine is straight and midline. The scapulae are equal and symmetrical. And now I'm just going to give a listen. Okay. All right, breath sounds on the front and back were clear, no adventitious sounds. Equal air entry to all lobes. Nothing of concern there. And now I'm going to move on to the heart if that's all right with you. Okay, the precordium seems to have no deformities. There are no heaves or lifts. Do you have any pre-existing heart conditions?
Nope.
Right, perfect. I'm just going to give a listen now.
Okay.
I'm going to be starting on the aortic region. Now the pulmonic. I'm just going to move your sports bra again.
Okay.
Tricuspid. And now mitral. And now for the last spot, I'm going to be listening to your apex for 30 seconds, okay? So there's nothing to be worried about. All right, S1 and S2 were heard in all 5 regions. The heart rate was 52 beats per minute. It was strong and regular. There were no adventitious sounds, no murmurs, no gallops, no raps, nothing like that. Nothing to be concerned about. I'm now going to move on to your abdomen.
Okay.
You can pull your gown up if you prefer to lay it down.
Okay. Yep.
Abdomen is flat. There is no distension. Skin is intact. There are no lesions, no bruising, no redness, no swelling. Umbilicus is midline. It is flat and round. I'm going to ask you a couple questions.
Okay.
What's your appetite like?
It's been pretty normal for meals a day.
Okay. Any vomiting or nausea?
Nope, not at all.
Constipation, diarrhea?
No.
Passive gas?
Yes.
Perfect. And when was your last bowel movement?
This morning.
And what did it look like?
Soft and brown.
Perfect. And how often do you have bowel movements normally?
I'd say twice a day.
Okay. I'm just going to give a listen now if that's okay.
Yep.
All right, active bowel sounds were heard in all 4 quadrants. And now I'm just going to do some tapping.
Okay.
All right, tympani is heard across the abdomen, and now I'm just going to do some touching. Any pain or tenderness with that?
Nope.
Abdomen is soft and non-tender, and now you can raise your gown. I'm going to ask you a couple more questions while you do that. Your urination, what's that like?
I'd say it's pretty good. 2 times a day.
Okay, perfect. And how much water are you drinking?
A cup a day, I'd say.
I would try to increase that a little bit if that's possible at all. What does your urination look like?
It's a deep yellow.
Okay. Do you have any pain with it at all?
Nope, not at all.
Okay, perfect. Do you have any reproductive concerns?
Nope.
Okay. And when was your last menstruation?
2 weeks ago.
Perfect. I'm just going to ask that you remove your arms. Sorry, I didn't ask that earlier.
Oh, okay.
I just need to see them,
Yep.
do a quick examination on them.
Yep, for sure.
Perfect. All right, skin is warm to the touch, all intact, no bruises, no lesions. There is noted redness from the shoulder to the finger on this one. Is that normal for you?
Yeah, that's my birthmark, actually.
Okay, perfect. No clubbing of the nails. Cap refill is less than 3 seconds. No tenting with skin turgor. I'm just going to ask that you move your arms around a little bit. Everywhere you can. Perfect. Bend the wrists. Perfect. I'm going to take your pulse.
Yep.
Radial pulse felt bilaterally. And brachial pulse felt bilaterally. Now I'm going to ask you to push against my hands. Up. And then just squeeze. No numbness or tingling or anything normally?
Nope,
Okay, perfect. Circulation, sensation, and movement are intact for the upper extremities, and muscle strength is 5 out of 5 bilaterally, equal to both arms.
Okay, and I can put my gown back
Yeah,
on?
definitely. You can put your arms back in, and then I'm going to move the blanket down if that's okay with you, just so I can see your legs. Perfect. All right, skin on the legs is slightly pale. It's all intact, no bruising, no redness, no lesions, no varicose veins, there is no edema. Cap refill on the toes is less than 3. The toenails are flat and white. Pedal pulse felt bilaterally. I'm just going to ask you to move your knees. Perfect. I'm going to move your ankles. Any pain with that?
No.
Tenders? Perfect. And now I'm going to ask that you put your legs up against mine. Feet against my hands. Forward. All right. Circulation, sensation, and movement are intact for the lower extremities as well. And the muscle strength is a 5 out of 5 bilaterally and equal.
Perfect.
Do you have any questions?
Nope, we're done.
Yeah. All results were normal and there's nothing to be concerned about unless you have any. worries or questions?
No,
Nothing?
I'm all good, yeah.
All right, perfect. Well, thank you for volunteering your time today.
Thank you.